right. Ohio political news. Salute! Salute! You know, they say it's raining cats and dogs, but they never say it's raining confetti. It's raining confetti. For a good reason. We got a good show tonight. And Chief Wahoo is joining us, too. We always got to keep tabs on that, man. Leonard is out there. How you doing, Leonard?
Doing well, sir.
All right. We'll count on that. And we've got our special guest here. Let me find him. There he is. Oh, why did I say Jennifer Gross? That's not correct.
We know that's not Jennifer Gross.
I'm not Jennifer Gross. No.
No, wait. She was on last week. Hey, before the show was showing up properly. There we go.
Sorry about that. Medicaid and some of the waste, fraud, and abuse that's involved in Medicaid. It should be a really, really good discussion. We'll probably meander our way into a little bit of property taxes as well. I just wanted to bring this to everybody's attention. Did you guys know that the scandal goes back to the days of George Washington? Look at that. He's using an auto feather. There he is to sign those bills. That's I thought that was pretty funny. I thought it was funny. All right, let's bring. Yeah, it is good. All right, we got to bring our guest on here tonight. Mike, how you doing? So District 17. That is Strongsville. That is Berea. That is where else? Is it just those two?
Royalton, Broadview Heights, Olmsted Falls, and a little piece of Olmsted Township.
You got it. All right. Great district out there. You're doing a great job. This is actually your second go-around, right? Because you were a state rep, and then you took a break, and then you became a state rep again, right?
That's right. I served 2011 to 2016 initially. Same basic district, although I didn't have Broadview Heights back then, and I had all of Olmsted Township, so it shifted just a little bit to the east.
Oh, okay. So it was a slight shift, and then you were able to get into that. Okay, very good. So what's the reason I found it very interesting is that you'd been on Bob France, you'd been on some other shows. I'd heard, I'd read on X where you were able to uncover a lot of potential waste, fraud, and abuse with Medicaid. And since Medicaid makes up possibly the biggest part of the budget, I think it's like 39% of the budget, roughly. So this is big news, and I wanted to dive into that a little bit. So am I right in saying that you uncovered about possibly $6 billion in waste, fraud, and abuse with Medicaid?
Yeah, it could amount to that much. We're really waiting to get some additional responses back from the Ohio Department of Medicaid at this point. But if you extrapolate the numbers that we have received back from a contractor that they use, we think it could potentially be that much. So it's not a small amount of money.
No, that's a huge amount of money. I want to show you this here. Let me bring this up here for a second. Now, Dave Yost actually oversees it, so it's part of the Attorney General office. And I get a kick out of it because it's like, well, how much are they actually catching? So if we're saying that there could be a total of $6 billion in waste and fraud and abuse and everything else, how much are they actually catching? And if you go down to that bottom paragraph right there, in 2024, they had 1,150 allegations of fraud, abuse, 116 indictments, 129 criminal convictions, 54 civil settlements, and they recovered $17 million in restitution and penalties. And I laugh at that because $17 million, and we're saying that it's probably close to $6 billion, right? So they're obviously missing a lot of the waste, fraud, and abuse, and it's not only with Ohio, but when you look at nationally, that is the line item that has the biggest problems. It's like one of the biggest line items, and it's also the line item with the most abuse and corruption and stuff like that. So can you tell us, like, how are you determining this number?
Well, if I can just sort of walk you through the timeline, that might be helpful for your listeners. So on April 10th, we sent a letter over to a contractor called LexisNexis, and they are one of, I think, a number of contractors that are used around the country for asset verification by various state departments of Medicaid. in this case, Ohio uses this one, and we asked them to go through their Medicaid eligibility verification data in this letter. And so they responded back a couple of weeks later, and they found a 29% failure rate among verified enrollees in the system. So that amounts to, if you take about $2,000 in benefits and then extrapolate that over a year and then multiply it by the number that are enrolled in this part of the system, that's where we get the $6.3 billion in potential waste from. Interestingly enough, and the asset limit that's in place in terms of a liquid asset limit, so we're talking about checking and savings accounts, and LexisNexis has access to like 88% of all U.S. bank accounts. So it's a verifiable source in terms of the numbers that we're talking about here. But if you look at the numbers they provided back to us, and $2,000 is the limit above which you're not supposed to receive this benefit, over 4,000 recipients had over $100,000 in liquid assets, and 12 recipients had over $1 million in the bank. So those are the most egregious examples that were found in the data that came back to us. So we went to ODM at that point and said, hey, this contractor that you use, this is what they found. Can you explain what you do with this data when you get it back from this contractor that you are paying with Ohio taxpayer dollars? They responded back and basically pointed the finger in two directions. One, at the county level job and family service organizations or agencies, and said, well, actually in Ohio, they're the ones that do asset verification checks. We don't do that at the state level here at ODM. And then they pointed the other direction up to the national government, to the feds, to Social Security Administration, and said they're the ones who are also responsible for doing income verification checks at that level. So not our responsibility here at ODM. It's a county thing, it's a federal thing, and we found out that Ohio is actually one of only 3 states in the country that relies on counties in this way to do this verification. And do y'all want to take a guess of what the other 2 might be? You're going to be horrified by this.
No, go ahead.
Yeah, California and Illinois are the other 2 states that do it that way. So not exactly a company that you want to be in. So we got this response back from ODM that was 3 pages. I've been in and around government for part of the last 30 years, good chunk of that time, and so I'm fairly proficient at trying to sift through bureaucratic gobbledygook, and couldn't tell you really what it said. So I'm a Gen Xer, so I still pick up the telephone and actually call people. So I called the lead shop over at ODM and said, hey, can you explain to me what this actually means? And can you answer just one question for me?
Okay, so wait 1 second, Mike. ODM is Ohio Department of Medicaid, correct?
Correct.
So you're calling the Ohio Department of Medicaid. Okay, and go ahead.
I just wanted one question answered. Of the data that came back from LexisNexis, indicating this substantial number of folks who are above the asset limit required by law, how many are actually removed from the rolls?
Mm-hmm.
And the guy told me, I don't know. So that's not really a sufficient answer for a legislator who's conducting.
Yeah, but that's wait. That's a typical. That's kind of the typical answer you're going to get from government. Now let me just back up here a little.
Answer.
Let me back this up a second, just so I understand it. So you're saying is a $2,000 asset limitation? What is the $2,000 again? What is that? What is the limitation? Is $2,000 in the bank or $2,000
in liquid assets?
In liquid assets, you can only have $2,000 to be on Medicaid. You cannot have more than $2,000 liquid assets.
Yeah, under this portion of it anyway. This is the age-blind disabled piece of it. So there are other exceptions for certain programs. A constituent pointed out to me as we were working on this that there are exceptions for certain types of chronic diseases like cancer and that sort of thing. But for the age-blind disabled portion of the population, it's $2,000 limit.
And that's liquid asset. And that's for disabilities, specific disabilities. And you found a ton of people with that specific disability, or apparently with that specific disability, but they had a lot more in assets, liquid assets. Huh?
Right.
And when you say liquid assets, do they count anything else? Cars, houses?
No,
Just liquid assets.
not the primary residence, not a boat, not stocks, not bonds.
So as long as you don't keep any money in your bank account, you can own anything you want. So anyhow,
which could indicate, if we're logical about it, that the problem could actually be much worse.
oh yeah. Well, yeah, and especially if nobody is checking. Okay, so let me extract again, and so that I understand, and then we can go with into more in depth and stuff. Some of the other guys can ask you questions. But okay, so what you're saying is that you did the research. You went to LexisNexis, and that's just a website, right? Is this what it is right here? Is this like this says LexisNexis?
It's a company. It's a company, and a lot of folks who are lawyers probably know LexisNexis as a place that you do legal research, but they do other things as well, and including data analysis like this. So it's a substantial company.
Okay, did you do the research just by going to the website, or did you have to do something else?
No, we sent them a letter.
Oh, okay. Sent them a
We
letter.
sent several contractors that we thought did asset verification for Medicaid a letter, and LexisNexis was the one that responded. And happily, I think they're probably the most credible one out there because they've got access to such a high percentage of data in terms of bank accounts here in the United States. It's 88% of bank accounts they have data on.
Now, couldn't the government, ODM, ask Lexis for this information, or did they?
Well, one assumes that if they're paying this contractor to do this work for them, that they're also receiving that information back. And so that's why my question shouldn't have been a difficult one back to the agency. What are you doing with the data that with our money, you're paying this contractor to do an extension of your work that you're not doing within I think it's like 700 employees that actually work for ODM. Right? I mean, this isn't uncommon in government. The contractor workforce is substantial, both at the federal level and at the state level, that sort of extends the ability of agencies to do their work. So they're paying this agency to essentially be an extension of their workforce. Why are they not then using the data effectively?
Yeah, good question. Why are they not using the data at all? Now, when you call ODM, Ohio Department of Medicaid, you're not calling a brick and mortar company. You're talking to a human being. So who is the human being? Who's this person that you talk to?
Well, in this instance, it was the deputy legislative director, Eric Vineyard, who was in touch with us and offered assistance. So we just picked up the phone and called him. And he was the one who indicated that they didn't really know what the number was. So
didn't know and didn't care. Did not know and did not care.
I won't make assumptions about.
I'll make that assumption. I'll make it. I'll make the assumption.
You know the answer, and I want the answer to my question. So
yeah.
I sent a follow-up letter back to the ODM director, Maureen Corcoran, the cabinet director who leads the agency, and asked a series of questions and indicated that I'd like to see the numbers audited and I would like a legal opinion from the general counsel. So, and I gave them a week to give the follow-up response back to us. They got back to us a week and a day later. They were sort of a day late and many dollars short on the response to all of this stuff. And this was a 7-page response back this time, which sort of doubled down on the 3-page response that I couldn't make heads or tails out of the first time. But it did reveal a really important point for us in an answer to one of my questions. And this was the answer. 6,023 age, blind, disabled, Medicaid enrollees. That's the population we're talking about. It's known as ABD, which is just 0.9% of the over 663,000 enrollees. This is in calendar 23, were removed. So just over 6,000 enrollees were removed from over 660,000 due to exceeding the asset limitations. So based on this data.
Due to asset limitations, specifically that one category, they got rid of 6,000. And how many did LexisNexis say?
They had a 29% failure rate in their liquid asset checks that came back. So 29% versus 0.9%. So a little discrepancy.
All right. Well, it's something to get the conversation going, right, Brian?
Yeah, I may have some questions, Joe.
Yeah, go ahead.
Thank you so much, Representative Dovilla. It's when you start giving us some statistics, I'm very, very interested in this. Now, when you say there's, you said $6 billion out of the $30 billion. Is this the $30 billion? Is this money, federal money received by the state of Ohio to be used for Medicaid?
Yeah, well, it's Medicaid, of course, is a federal state partnership in all of the states that dates back to the 1960s when the program was created. And each state has a slightly different percentage that it receives. It's based on a formula. Here in Ohio, we receive about 2/3 of the dollars from the federal government, and then the state pays 1/3. And except for the Medicaid expansion population, which I'm sure you're all familiar with from more recent years when that was put into place 12 years ago, that's a 90-10 split, 90 federal, 10 state. And of course, that's one of the things that's being looked at right now at the federal level is whether those dollars, that percentage will move at all in terms of what the feds are putting into it. But for the purposes of this conversation, we're talking about the traditional Medicaid population, which is about 2/3, 1/3.
And how big is the $30 billion? What percentage of the total state budget are the $30 billion? I understand it's the federal government pays out over 50%.
Yeah, it depends which budget you're talking about. It's about 50% of the all funds, what's known as the all funds budget, which draws down money from the feds, and it's lower than that if you count just the state portion of it. So I think that's probably where you're getting the 30-some%. But if you count all funds, both general revenue fund dollars, which is your tax money, as well as the federal drawdown dollars, it's about half of our budget.
That is a massive amount. A massive amount. Yeah.
No, that's just incredible.
For comparison purposes, about a quarter of the budget ends up being K-12 education, and then the final quarter is everything else, right? Prisons, parks, you name it. So that's just a back of the envelope, really quick version of how the budget breaks down.
You know, Mike, I was trying to gather some statistics myself, and it's apparently a little over 3 million people are on Medicaid in Ohio. A little over 3 million are on Medicaid.
Yeah, out of a population of just shy of 12, right?
That is a lot. Yeah, that is a lot. That's way too many. That's way too many people that could possibly be on Medicaid. Either we're the poorest state, or there's a lot of people on there that shouldn't be. One of the two.
Yeah. Well, and there's two major reasons why the numbers are that high now. One is the expansion effort that went into place during the Kasich administration in 2013, which I was not supportive of, and we didn't end up voting on in the legislature. They used the controlling board to sort of do an end run around us. And then, of course, COVID was another significant driver in the population, just at the general level, not even in the expansion population. So over the last 12 years, you really had a massive expansion of folks who are receiving this particular benefit. And my main concern in entering this oversight process was that the people who need to receive these benefits, and that population does exist, should be getting the dollars that are coming their way and not have them diluted by folks who have no business receiving this benefit at all.
Yeah, there's massive fraud with the whole Medicaid thing, and you know it's not just people that have too many assets like you're talking. It's also the nursing homes. It's the hospitals. These providers that just keep jacking up the price. You know, they overcharge for everything, prescription drugs, you name it. It all gets overcharged, and they make a lot of this right here, a lot of money off of Medicaid because the state then is reimbursing them, but nobody seems to be like policing it. And if you're catching, like that fraud unit is catching 17 million out of a possible 6 billion, that's like less than 1%, maybe a 0.5%. So you got a 99.9% chance of never getting caught, the way I look at it, if you want to cheat on Medicaid. So why the heck don't you go and do a little cheating? That's not what I would do, but I'm just saying it's ripe for the picking right there. The fraud unit is a joke. It's an absolute joke, man.
Joe, we don't know whether or not the individual citizen knows about the rules, though. We can't make that blanket statement unless I'm missing something. It's up to those that are administering the rules and regulations to tell them and also do the checking. Unless I'm missing something.
Well, you got to sign up for Medicaid. You'd have to sign up, so I would assume that they would make this stuff clear, right? You're not Jennifer. What the heck is going on here? That's better. Mike, so when they sign up for Medicaid, I would assume that somebody there at the department is telling them the specifics.
Yeah, well, it's at the county level here, apparently, and that was what they pointed out to me when we reached out. So it's not clear to me exactly then what the role is at the state level, other than to be an interlocutor between the county level agencies that are apparently managing this program and the federal government that's shoveling out the money, portion of the money anyway.
So the state,
Joe. So you know what I?
Yeah, go ahead.
When I hear that, Joe, when I hear that, in Job and Family Services, because of my involvement in the county, I know the person that's running Job and Family Services. So tomorrow I'll reach out and I'll ask them, how do they monitor people that are enrolled in Medicare or Medicaid rather, and what kind of checking do they do at the county level? If Representative Dovilla is saying that most of the problem is at the county level, we owe it to ourselves to check the Job and Family Services at the county level. Let's see what's happening as citizens.
It sounds like they're passing the buck a little bit there. Let me go to Jonathan. Jonathan, you have a question for Mike?
I've got a question or 10. First thing is, I'm going to refer to this as Doge Medicaid, and thank you for taking this on. A few things that occur to me, if this is happening at the county level, and I actually was guessing at least California, and I was thinking either Illinois or New York, so I think I was spot on with my guess and your trivia question. If it's happening at the county level, are you able to pull out of there and point to the counties? Because I suspect they're going to be the usual suspects. They're going to have Franklin, Hamilton, and Cuyahoga probably leading the list on the alleged fraudulent behavior. So a few things. If there's a 29% failure rate or somewhere thereabouts, how far back does that date? Is there a time when examinations of eligibility were conducted and maybe stopped? So are we looking at what is it, 6 billion? Are we looking at 6 billion times the last 10 years? So that's a question that I have. And you touched on, actually, I made a note here. One of the first things I was going to say when presented the opportunity to speak was my skepticism of Medicaid expansion. And you already touched on that. Thank you for voting in opposition. Is the Medicaid expansion, I think the push is still going on, especially from DeWine's office, to continue to expand the thing. And I think the more Medicaid, the more bloated it gets, the more little crevices there are to hide fraud, abuse, and malfeasance. That's my opinion. And one last piece that I think is front of brain for a lot of people right now, do you have at this point any sort of feel for whether or not illegal immigrants in Ohio are gaining access to Medicaid?
Yeah, great question, Jonathan, and we're on the same page on all this. I think it's a reasonable assessment to assume that it's the largest 3 counties where we would see a great deal of this. But again, my working assumption on this is that the state agency that manages this program would be able, from the 88 counties, including the 3 large urban counties, to have rolled up numbers, so that I, as a legislator with staff of 1, I don't exactly have time to go to 88 county Job and Family Service offices to find out what's going on with this. I would expect that the agency responsible for it at the state level that I oversee would be able to do that for us. Spot on the expansion piece. I think that's a large generator of some of the challenges that we're seeing in the program overall. And I made a comment, I think it was on Bob Francis or Jack Windsor's show recently on illegals, almost certainly being part of this expanded population of folks who don't belong on the program.
Oh, gotcha. Wow. Yeah. Okay. So let me understand this, Mike, because you're delving into just one area. So you're not looking at healthcare providers that are overbilling, right? You're not looking at, like I was reading one case. This guy said that he did counseling for this person for 20 hours in one day, 20 hours of counseling, and billed Medicaid for 20 hours. And then you have these other cases where they're saying they have ghost patients. These patients don't really exist. They have dead patients, okay, that they're billing Medicaid for. And then you have, like what you're talking about, people who don't qualify, and they're using those people. They're extracting the Medicaid benefits and everything. So this whole umbrella is huge. But the area that you're just focusing in on is very specific, right? They have specific disabilities, and it's a $2,000 liquid asset limitation, right?
That's correct. Yeah. So what to sort of expound on the point I think you're making, there's a lot of other areas within the agency and within this program that are ripe for abuse as well. But we're just looking at a very carefully prescribed portion of the total population, and a very specific limit in terms of liquid assets. So it's much broader than this, I'm sure. But the purpose of this oversight investigation is just to handle this part of it. And this could be done in the other 49 states as well. It's my understanding that several other states have a similar investigation now underway through their legislatures.
Yeah. Ask Leonard, do you have a question you'd like to throw? Quite curious about anything?
Yeah, I was just, first of all, let me say thanks for joining us. I really appreciate taking the time to do this. I think we all know, well, I hope most of us know that the nation is basically financially bankrupt. And knowing that that budget is 50% dependent on the federal, if for some reason that spigot dries up, will the state be prepared to handle that?
Well, that's a great question, Leonard. And in the executive budget that came up to us from Governor DeWine, there was trigger language in there that indicated that if there was any change to the percentage coming from the federal government, that we were not going to make up the difference. And so a lot of folks out there who represent a variety of organizations were not happy with that. We kept it in the House version of the budget. We'll find out on Tuesday afternoon what the Senate has done with it. But I'm as concerned about that as anyone. We simply don't have the additional dollars at this point to be able to make up any kind of additional gap caused by the Fed shifting the percentage that they put in. And that was the main reason, one of the main reasons back in 2013 that I was opposed to the expansion, because I didn't trust that the offer that was made at that time, which was 90-10 for the expansion population, would be a promise that the federal government could keep in perpetuity. Just to your point, given the fiscal condition at the national level, which is beyond bankrupt at this point.
So with Trump, we have a question here. Lighting taxpayer money on fire. Yeah, if you're in the chat and you have a question, let's hear from you. Love to hear from you, and we'll post it up there and see what Mike has to say about it, because we definitely want to do that. So if you're out there in the chat, please chat. So Mike, if we go back to what you're doing, so you have found, or LexisNexis has discovered 29% waste, fraud, and abuse, or 29% of the people had $2,000 or more assets. So what happens now? I mean, if you present that to ODM, Ohio Department of Medicaid, are they just going to say, okay, nice, we'll get back to you? Or, I mean, What's going to happen here? Maybe you could take it to the fraud unit. That might help. I don't know.
Well, they came back in this letter and they did a few things. One was to basically say, well, that's information that just comes back. It's not data that is being tested, is the term they use for it. So I'm not sure what the purpose really is of them using this contractor to just pull all this data together if it doesn't qualify as actually testing the data in terms of whether the individual we're talking about in each of these instances is qualified. So they're trying to really, I mean, it was double speak, parsing language on it, but the bottom line was, I don't think they're using the data that are coming back from this particular contractor. So they really offered a misleading explanation of the data, first of all. Secondly, they understated the severity of the disenrollment figures, and as I mentioned, that was only about 6,000 out of the total population. And then they did mention that there were audits that take place from a variety of different agencies, including the auditor of state. But again, the example they used, they really cherry-picked the data that came back. They indicated that what they call a small audit sample from the auditor of state suggested low error rates, but they only reviewed, in this case, 10 out of 320 cases and found errors with them. So I really think they cherry-picked the data out of one small audit that took place through the auditor's office. And I need to reach out to Auditor Faber as well and see if we can just get a more comprehensive audit of all the data that we're talking about here so that they can't play funny business with the numbers, which is what I think they're doing.
Okay, so Keith Faber is the auditor, and so it would be his job. What would be his job in this? It doesn't seem like the auditor, the attorney general, or anybody is really policing this. That fraud unit comes under the attorney general. The audit comes under Keith Faber. So what are these guys doing? Anything or?
Well, government's big, right? And so there's not an opportunity on an annual basis for these guys through either one of those offices to go through every single program of government. So I imagine that they're taking small subsections of programs and probing them to make sure that public dollars are being accurately spent. But again, the example that Director Corcoran came back with here, I think was a very small sample used to sort of prove her point that there's no there. And I just don't believe that based on the other data that come back from LexisNexis. That makes no sense to me. It was buried in a 7-page letter to basically obfuscate further.
Hey, Joe.
7-page letter. A 7-page letter. I don't want you to read that to us because we'll fall asleep. But a 7-page letter.
I don't know if I could.
You did all the work. You gave it to them, and then they give you a 7-page explanation as to why you're wrong or something. Who knows?
Yeah, and that was basically what it said. Is you don't understand. It was characterized in a way where it was basically framed as LexisNexis doesn't know what they're talking about, but what they really meant was, Representative, you don't know what you're talking about. And that's not really a good approach to take with a guy who's been doing this for a long time and is the vice chairman of the Finance Committee.
Exactly.
The fact that even if they aren't blaming me, if they are blaming the contractor, it's their contractor. They're paying LexisNexis with public tax dollars.
That's
to pull
hilarious.
together.
All right, so they're paying them. Oh, wait, sorry. They're paying them, but then they're saying that their information is not accurate.
Right.
Yeah, you can't follow their information. It's not reliable or anything like that. And the last thing I want to say, Mike, is you are a state rep. You got a lot of clout. You've been in the state house. You've been out. You're back in. Just think about the regular citizens like myself, like Brian. Brian's always saying he gets the runaround whenever he tries to go to Columbus to do anything. I mean, they treat us, 10 times worse. That's just pretty darn amazing. Let me go over to Jonathan here. Go ahead, Jonathan.
All right. So the first thing is I've worked with LexisNexis for decades now, and I agree with you. They're a big provider. And they're overwhelmingly very credible. They have access to a great deal of information. However, I think for context, and if you'd care to comment on this, I'd appreciate it, they are a for-profit entity. And they have to create this balancing act. If they provide data to any public, a governmental entity of any sort, and that's used to upset the apple cart, so to speak. I think that they know they run the risk of losing that contract, and I'm sure it's a very lucrative contract for them. So I think they probably made the comments that they did about maybe testing or whatever in order to create some wiggle room for themselves. I've seen that sort of thing done by these providers before, and I can't say that I blame them, but it's frustrating because at the end of the day, when we do end up with an array of different people trying to get to the meat of the substance of some issue, and we got everybody pointing at somebody else and everybody creating some sort of wiggle room and not providing tangible answers, it can be very frustrating. Connected to that, my question is the $2,000 threshold subject to the 5-year look back? And just for clarification for our audience, there are many environments where if, I'm sure you know this, Rep. Dovilla, if you have a certain amount in assets or above, you're ineligible for certain types of benefits. What they've figured out through the decades is lots of people anticipating that they're about to request something or seek some sort of aid package, they'll just give all their money to their brother or kids or grandma, and suddenly, lo and behold, when you look at their bank account, you see $1,999 below the threshold. Their $1 million is with their spouse or somebody else. And so for that reason, many different environments are subject to a 5-year look back where you have to show your financial records. I'm wondering, and this part I don't actually know, if LexisNexis can get that granular and pull that sort of detail. If they can, it may be clear indication or may provide clear indication that some people are understanding the rules and skirting them.
Yeah, that's a great observation, Jonathan, and I also don't know the answer to that. That's a level of granularity I just haven't gotten to at this point.
But it does make a lot. That does make a lot of sense. It's like get rid of your assets and stuff like that. But it also doesn't sound like they're really scrutinizing whether you have $2,000. I mean, that's not a whole lot of money. But when you say liquid assets, so you could have cars, you could have a boat, you could have a house or multiple houses. It's weird. It's pretty dumb.
That's just cash in the bank, right?
Yeah.
Whether it's a checking account or a savings account.
Yep, that's right.
Yeah, which is kind of ridiculous.
Representative Dovilla, is there anything that Ohio Political News or the average citizens, what can we do to help us?
Well, this is helpful in itself, and I've been trying to do as many interviews as I can, and they've all been at the state and local level at this point. We're hoping to get more broad national reach. There was a piece that ran in Breitbart a few days ago now, so that was helpful. And again, I think as this story starts to get more legs to it, as other states are engaging in this type of investigation as well, and as the reconciliation bill continues to move through the process now in the U.S. Senate, there's the opportunity for more dialogue. So we really just want to highlight that this is underway here in Ohio, and we've been working on this for about a month and a half now in a formal way.
Yeah, what I can promise you is I will send to your office any reactions that we get from the Lake County Local Job and Family Services, because tomorrow we're going to reach out to them and we're going to try to find out what their response is, and we'll be glad to send it to your office.
Yeah,
Thanks, Brian.
That's so crazy that you have to go to each individual county. So I'm in Cuyahoga, so I got to call Cuyahoga to find out the information if they're a asset verification and stuff like that. It's a lot of legwork, and like you said, what's the point of a state organization if it can't be like to cut time and effort and everything and just go right to them to get all this information on the 88 counties? That is so much the way government operates, which is the most inefficient way possible. And they've gotten like that because we've never kept an eye on them. We've never scrutinized government, and we have to start doing that. Okay, if you got one more thing, Jonathan, go ahead, Dan.
Oh, actually,
amigos.
I was agreeing with you, but I will gladly take the opportunity to. This is sort of a related or connected note in my book. You were talking about holding government accountable, and in Rep. Davilla's territory is Strongsville. Strongsville has a club, the Strongsville GOP, and Shannon Burns has been a guest on this program before. I've had detailed conversations with Shannon Burns about what they do very powerfully and very differently in the Strongsville GOP. And a tip of the hat to those guys. They're doing it right. We've had some conversations. Those of you who watch the show regularly know that I am one of the national voices of precinct strategy. Those are of us who are pushing for more local engagement at the local level for average citizens. And Strongsville GOP, in my book, represents a really good example of that. And it's complementary to the things that we're doing at precinct strategy. So that's a side note. I don't know, Rep. Dovilla has anything to comment on Strongsville GOP, but actually I do have sort of an analogy. At listening to Rep. Davilla's description of the tiny, and according to the numbers that were shared with us in today's podcast, they're tiny numbers in reaction to finding fraud and efforts to find and weed out fraud within Medicaid. I'm reminded of last year's activities from Secretary of State Frank LaRose. This is an aside, but to me, it's a mentality, and I think it's wrong. I think it's broken. We have indication from a citizens audit that was done in Ohio's election voter rolls of an estimated 1.3 million bad or questionable entries in our state voter rolls. And Frank LaRose came out with some comment that he had found and removed 763 people or something like that. Well, I quickly came out and did the math on it and illustrated that at that rate, it will take a little over 7,000 years for us to clean up our voter rolls. In very similar fashion, the numbers that Rep. Dovilla has shared with us today are incremental, tiny. I'm not going to say they're not useful, but they're useful in the 1,000-year time frame, and I think that's ridiculous. We need more people in government willing to step up and really get into the fray and fight it, because these are battles. When you're talking about the billions of dollars that flows through something like Medicaid, the amount of fraud and the number of people who benefit from it is a fight. We need more people in that fight, and I believe, personally, I'm very committed to the fact that we won't get that fight unless more of us at the regular we the people level fight for it and advocate and get loud and active and vocal. And that means being things, forming things, and going to things like Strongsville GOP, form something like it where you live, or follow us at Precinct Strategy, or do both.
You know, I want to just piggyback off one thing you said there, and it's kind of along these lines is the way I see it, is that the government is not policing any of this, so it's just leading, that is just encouraging the waste, fraud, and abuse, because they know they can get away with it, and you can make lots and lots of money doing it, so why not do it? I mean, it's like enabling a drunk, you just keep putting alcohol in front of them or something like that. Yeah, do you have anything you wanted to just kind of wrap it up with tonight, Mike? But before you do, I might hold you on a few more minutes, because I did want to meander into some property taxes if you have a few extra minutes. But anything you wanted to say?
I will take the opportunity that Jonathan teed up there just to offer my thanks to the Strongsville GOP and Shannon Burns and his whole team there. Wouldn't be back in this seat but for the great work that they helped us to get done during the campaign last time around, and they've been real advocates for these kind of policy fights as well. I've pointed out through this process as I've been working my way through this particular investigation that I think being an effective legislator is about three things. It's writing laws, which of course is a fundamental part of the job, constituent services, and then the oversight piece. And that's the part that often doesn't get done. But I've been doing this for, back to, 25 years ago is when I started with Senator Voinovich working on the Oversight of Government Management Subcommittee in the U.S. Senate. So I'm familiar with how to conduct oversight investigations and how to dig into the details of really complex public policy areas. And this is one of them. So it's part of the reason that I wanted to get back into office at this point was to really look at these programs one by one. And this one is so big, it's half the budget, that it was the place that we wanted to start. But there's more to come as we go along.
Well, that's excellent. Yeah, I mean, you're doing a great job. And yeah, kudos to Strongsville and Shannon Burns. They do an excellent job. Fantastic. I can spend a whole show talking about that if we wanted to. I want to just meander into this whole idea with property taxes for a second here, because Mike, I want to get your take, and Brian, you're going to get a kick out of this. Listen to this.
We have a property tax crisis in this state. Things are out of control, partly because of that inside millage and how out of whack it went with the recent assessments.
All right, well, this is from Cleveland.com. Very, very liberal, but they were talking about the whole property tax thing here. So let's just give it a listen. Listen to this.
And they have a chance to do something bold, to really reform the tax system in Ohio to reduce voter anger, because we have this ballot initiative that could get on the ballot, and if it does, very likely would pass, to abolish property taxes altogether and put the state into chaos. It's all going to blow up in their faces because this property tax initiative is real. And if they don't do something real to fix it, it's going to pass. And then the income taxes will have to go up. The state will not have the money to do what it needs. It'll be an absolute chaotic situation. Some people write to me and say, I want it to blow up. Because they're so corrupt and sleazy in Columbus, the only way we'll get real change is to create chaos.
Yeah, so I want to get your take on that. So that was Cleveland.com. They're talking about the whole property tax initiative and everything like that, and it sounds like they getting a little concerned there. But I thought it was kind of cool that they're talking about it the way they are. What did you think?
Yes, it is cool. Our intent is not to create chaos in any way, shape, or form. Our committee was established because the state legislators, our own personal representatives, senators and representatives in Lake County, they just would not even meet with us. They wouldn't talk to us. We, Leonard and I and John Morrow, went down to the state capitol. We spoke to the House Ways and Means Committee. We spoke to the Council on Reform and Review of Property Taxes. We rented a room at the Capitol building, cost us $50 for an hour, invited leading senators and representatives to join us. They just sent, I think there was 6 legislative aides. So they basically ignored us. And then we said we have to take some drastic measures because they are not listening to the average citizen. We were originally thinking of how do we save our seniors, because we have said for many, many years now that if we stay on this path of ever increasing property taxes, we are going to price seniors and those living on fixed incomes out of their home. There's no question that we are right with that. This recent sexennial revaluation in Lake County, Geauga County, and a third of the other counties that just experienced it last year, it brought the point home that this is not sustainable. It is just not sustainable. And the whole system of property taxes is far too complex. No one understands millage, outside millage, inside millage, House Bill 920, 20 mil floor, and assessed value versus market value versus true value. Even some of the legislators do not understand it. And the other thing that we've been telling, and I did see you, Representative Dovilla, at a town hall meeting, and he and Representative Dave Thomas, so I give a big shout out to them. At least they are talking about it. Dave Thomas, I know, has several changes in the law, but we still don't think it's going to be enough. And we have started collecting the signatures. If we don't get it on the November 2025 ballot, we're going to try for May, and if we don't get it on May, we're going to get it on the November 2026. and we think it will pass. So it's incumbent upon all of our state legislators to take the citizens serious, on this issue. We're not going to go away.
No, you're doing a great job. So, Mike, what do you think about that elimination of property taxes? What's your thoughts on that?
Well, as was noted, we did hold a town hall here, and I think we're probably over 36 or more different bills related to property tax that have been introduced out of about 300 so far this session. So folks are working on the problem. I'm just not sure that a lot of the bills that have been introduced are going to scratch the itch completely, because they sort of continue to nibble around the edges with different pieces of exemptions and that sort of thing. And I agree that we need a more fundamental fix to the problem. The challenge with it is we didn't get here overnight, and trying to fix it overnight creates its own set of challenges, as you all have indicated. But that may be the way that this has to go. It's my personal opinion that you are going to get the signatures for this, and I think if it makes it on the ballot, it does pass. Folks just need to recognize that punches a $22 billion hole in the budget each year that's got to be addressed. I'm already looking ahead to the point after the budget to try to address some of those things. Ohio is number one at something that none of us should want to be number one at, and that is the number of political subdivisions that have a taxing authority in this state. It's over 6,000 units of government. We are the top state in the entire country for government, and that's got to go. So I'm going to be taking a look after I've been super busy with the budget, obviously, as the vice chair of finance for the last several months. But once we get past this and I have a chance to breathe and focus on some other things, I want to take a serious look at how do we do more in the way of shared services and even the C word, consolidation. And that's something folks don't want to talk about a lot. They love their home rule provision of the Constitution. I respect that. It's been part of the Constitution for over a century. But the reality is we have too much government, too many layers, and too many entities that can tax us. That's really, that's the other side of the problem that has to be addressed. This doesn't get fixed just at the state level.
I'm going to bring Leonard in. Leonard,
Dovilla,
here. Leonard, you have something to say? I'll come right back to you, Brian. And then Jonathan.
Yeah, there's something fundamentally wrong with our society when you look at a person's home and the government is tied to that. There's something terribly wrong with our mentality. And we're not saying we're not going to pay taxes. What we're saying is remove the mechanism from our homes. And then secondly, when you look at the role of government, we're saying there's a lot out there that can be streamlined. You got a lot of overlap. And what, contrary to what people don't understand, is that when you actually cut taxes, you will spur growth because you're going to put money in people's pockets. Governments actually succeed or are far more efficient because they're going to have more money coming in. And if you reduce it and streamline it, we could set a trajectory for the nation. This is a major opportunity here, but everybody's panicking and not realizing the potential of what we could do as a state and set the stage for our next generation, because that's what it's all about. It's generational thinking. It's not about us. So that's my comment.
No, it's a good comment, and I'll just piggyback off that for a second, and that is a lot of people aren't considering that. You said, like you just said, there's a $22 billion hole, but not really. If you get rid of the property taxes, all that extra income that people have, they're going to be using it to buy more, so the sales tax revenue is going to explode. I don't think you get $22 billion out of sales tax, but I mean, it is going to cut into it.
But it won't be that large of a gap. You're right. And I agree. And it's why, during my last period of service in the legislature, I voted every single budget for an income tax reduction. We eliminated the estate tax during my first term. So Republican majorities have worked to get the tax burden down in the state. But the one piece that has really been ignored has been the property side of it. And I will tell you, gentlemen, that this is the main thing that I heard about on the campaign trail last year in terms of a local issue. Of course, we were hearing about border security and inflation and cost of things and what's going on in Washington, all that sort of stuff at the national level. But here locally, this was the top issue that we heard about as we knocked on probably 20,000 or so doors again last cycle. So we get it. We're serious about it. We've got to figure out a way to do this. And if it ends up being the ballot initiative, so be it. But just know that there is work that's being done now, whether it's through the budget or these other freestanding bills. And again, there's about 36 of them that are in various states of of development from so the introductory stage all the way through to some have actually been passed. So the one that may have been referred to from Rep. Thomas that eliminates replacement levies as opposed to what are the two versions, replacement or renewal. So it eliminates renewal versus replacement because there's confusion. Renewal isn't always at the same
Representative
level.
Dovilla.
There's only one
It's a higher
topic,
amount.
one topic more confusing than Medicaid, and that's property taxes. But
Or maybe school
Yeah,
funding,
Representative.
which is related to property taxes.
Yeah, the concern that I have, and I've been mentioning this at the local level for a long time, that there are no checks and balances in our system that can curtail or curb the spending of the many thousands of taxing authorities. I've seen it in Lake County, and what this has done is the taxing authorities have accumulated massive amounts of money that they put in their rainy day fund, and this including schools and also Deepwood, Metro Parks, the crime lab. Everybody has to have their rainy day fund, and I keep saying that you cannot keep sucking the lifeblood out of the economy. That money's got to go back into the hands of the taxpayers so that they can generate keep spending the money in the economy, and it keeps everything moving forward. So I know Representative Thomas said that he was working on that, and I think that the Budget Commission needs to have greater teeth or authority to control the spending.
Yeah, well, that's absolutely right. And David just dropped a bill in recently on that piece. And you've alluded to another provision that's actually in the House version of the operating budget that caps the school district carryover at 30%. Now, we'll see what the Senate did with that in their budget process that's been underway since April 9th. But it's absolutely right. We, at the state level, our rainy day fund, our budget stabilization fund limit is 10%. And that fund is just about at the 10% max at this point. But you have some school districts out there that are carrying over 50, 70, 100 or more percent of their annual budget. And, all out of concern that they're going to need it for the next contract negotiation with the union or what have you. But the reality is, and they're making money on it. I mean, I'd rather have them making money on it than not. At least they're investing it somewhere. But where I'd really rather have the money is in your checkbooks to do what you want to do with it. That's way beyond excess funding that they just simply don't need.
Yeah, absolutely. Jonathan,
Thank you very much.
let you wrap it up here tonight, if you would.
Okay, so chaos, took us. The premise that it's going to cause chaos to fundamentally alter our taxing system, it concedes failure at a certain level that I continue to advocate we need to be more on top of. Here's what I mean by that. We have gotten accustomed to, what do they call it, normalization? You can normalize anything given a long enough time horizon. You can do something terrible and then get people used to it. We're used to overspending, and there are all sorts of examples around us. We're seeing the results of Doge. Doge, I think overwhelmingly, at least on our side of the aisle, is popular, or at least understood. And in Ohio, just looking at property tax on average accounts for 60% on average of property tax goes toward schools. And our school systems are a horrible mess. Everybody, I think, has come to some level of realization of that. Ohio is struggling. And Ohio, well, it used to be a top 10 destination for education, has slid significantly. And the U.S. as a whole is now roughly last place of industrialized nations. Yet we spend vastly more than anybody else anywhere on earth for education. I'm going to propose the average, because it's really hard to pin down, of around $17,000 per pupil per year. There are some districts like Cleveland where they're 44,000 or have peaked out at 44,000, or Willoughby East Lake at about 42,000. But all of that doesn't even take into consideration another layer of educational expense, which is called Education Service Centers, or ESC. Those are regional districts that do things and have their own taxing. My point in bringing all this up is we've allowed this broadening, expanding bloat to happen over decades as our education, our academic proficiency has suffered. We're spending more to get less. As a note for anybody who's new to this program, when I first joined this program 2 years ago, I was serving as a chair, board member, and territory lead of Protect Ohio Children. I'm also the co-creator of the Ohio Academic Accountability Project. If you go to Protect Ohio Children, there's a menu there, Ohio Academic Accountability Project. One of the features of that allows you to look up any school district in Ohio and look at the cost per pupil. You can pull their financials. It's egregious. It's awful. I've been pointing it out forever. And it's not until enough of us parents, enough of us tax-paying community members all over the state of Ohio balk at those figures. We cannot continue. And as a note, as a recognition of our fine teachers out there, this is not an attack on teachers. There are some bad teachers, and I know those on our side like to call them out. But we have great teachers who are vastly underpaid because we have administrative bloat. I'm just giving you one example. This is an example of how government creep and crawl has spread like a vine through decades, and it's strangulating, it's suffocating education. If we take that approach, if we proactively look at the efforts that we're making to remove that hammer that hangs over the head of homeowners, that concern, that fear that we might lose our home at any day. And actually, I'm going to give you a specific example. Somebody sent me images of a letter, their property tax that for decades, they've been spending about $1,800 a year. Their new assessment moves them to $18,000 a year. They can't afford that. That's just one example that was sent to me. That's that is a hundredfold increase in property tax, and they can't afford $18,000 per year. So when do we, the people, enough of us, step up, get engaged, and start asking the questions? Do we need 75 different administrators in your local school district? Do you need I call them the racism czar, that DEI CRT person? Do we need all those people? I think the answer is no. Back when we didn't used to have them, kids were proficient, or mostly proficient, at reading, math, and those sorts of things. I suggest, should be demanding more for less. And my last parting thought on that, to give a fine point to it as an example, we all remember, who are paying attention to social media, when Elon Musk took over X, formerly Twitter. And what did he cut? Like 80% of his budget and staff, and everyone said they couldn't possibly survive at an 80% cut. Well, I think it's personally a much better. So why aren't we talking more about doing exactly that with things like education and all those various other places that our taxpayer dollars seem to disappear into, and we get very little in return?
No, that's a very good point. Let's Mike, you can comment on that, and then also we have a question from the chat. So let's also throw this at you at the same time here. Could Representative Dovilla explain the $22 billion hole that would arise? Where does that come from? Now, it's my understanding that that's what we collect in property taxes, right? $22 billion?
That's right. That's right. That's just the revenue figure. So, but again, that's not even at the state level. So it's not like it's going to punch a $22 billion hole in the state budget per se, because those are dollars that in many cases are collected at the local level as well. So. And I will associate myself with many of those comments that Jonathan just offered, and we're also taking a look at ESCs and the school funding side of things, and potential shared services that can save money on the education side as well, at the K-12 level. there's a lot of benefits that can be reaped, I think, from getting those budgets skinnied down.
Well, the government has to go on a diet, and so does the school system and everybody, We all have to go on a diet. I have to go on a diet. So that's the key here. We've got to start looking at ways to cut and put more money back into our pockets, and that's what will grow Ohio, ultimately. Ohio will become a great place to live if we start doing that. Well, Mike, thank you very much. Appreciate you taking the time to join us here tonight. And, God bless you.
Thank you very much, Representative Davilla.
God bless
Thank you, Rep. Dovilla.
Yeah, thanks a lot. Have a good night, everybody. Have a good night.
Thanks, Joe.
Thank you. All right.
See you, Leonard. Bye, Jonathan.
Good night, all.
All right, sir. Night.
Now you're the ones who've lost their touch.